Freedom Day in England, July 19. The day the country lifted almost all coronavirus restrictions. Other parts of the UK soon followed. But did it come too early? Freedom Day meant no more masks and no more social distancing. About half the adult population was fully vaccinated. Officials were confident the threat to public health had been minimised. But now Britain has among the highest confirmed cases in Europe. More than 40,000 a day.
Welcome, I'm Ben Fazoulan. Medical experts are calling on the British government to bring back social distancing. The government is refusing, relying instead on booster shots to protect the most vulnerable.
This is how the UK wants to get through the winter. A third COVID-19 shot for 30 million vulnerable people. But many vaccination centres have closed and the vaccination programme is sluggish. 76-year-old Ivor Garfinkel died while waiting for his booster shot. His son blames the slow pace.
He was literally going out shopping, going into his hospital checkups and things like that. And he caught COVID. 11 days later, he died. I genuinely do think a booster might have saved his life.
Case numbers are the highest in Europe, but a vaccination rate above 67% has kept down severe infections and deaths. After lifting all restrictions in England, the government's strategy seemed to be working, but the tide is turning. The UK registered 223 deaths on Tuesday. Nearly 1,000 people were hospitalised.
We have relatively low social distancing measures compared to much of Europe. The other big thing is, I think, immunisations. That immunity from either previous infections or immunisations are almost certainly beginning to wane.
The protection offered by the AstraZeneca vaccine, the most widely used in the UK, appears to decline significantly over time. But boosters are urgently needed for other vaccines too. The UK's National Health Service says it's time to act. They're calling for the government to trigger its Plan B, a set of measures including mandatory mask wearing, vaccination passes in certain settings, and recommending people work from home.
Is it time for a COVID Plan B, Prime Minister?
The government is rejecting calls to trigger fresh restrictions. At a news conference on Wednesday, the Health Minister said he expects up to 100,000 cases a day in the coming weeks, which means more severe infections and deaths are likely inevitable. He appealed to the public for voluntary support.
If we want to secure these freedoms for the long term, then the best thing that we can do is come forward once again when that moment comes. There are many more things that we can all do to help contain the spread of this virus, like meeting outdoors where it's possible, and if you can only meet indoors, letting in fresh air, like wearing a face covering in crowded and enclosed spaces.
When asked why ministers in a packed parliament weren't wearing masks, the health minister conceded good point and said lawmakers should set an example. Winter is coming and healthcare workers are already feeling the pressure. Yet another concerning new variant is making its rounds, and the coming weeks may well be decisive for the United Kingdom.
Let's bring in Heidi Larson, Director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. She joins us from Brussels. Did Freedom Day come too early for England, in your opinion?
Yes, I think it was a bit, Freedom Day was perhaps a bit premature, but I think that, we have to think about freedom in relative terms because I think too much too soon is let's put it this way, the pandemic is highly volatile. I don't think anywhere in the world is ready for full freedoms. If you think of it kind of frames restrictions as being not freedom, but we're actually trying to get freedom from the disease. So yes, in trying to throw off all the restrictions in one go, it was probably too early. I think it needs to be an evolving process.
I mean, it sounds like a great public relations campaign, but when you look at the reality of things, the vaccination rate, for example, isn't it far too low for such freedoms?
Yes, and it's not just vaccinations definitely have lulled in terms of uptake. There was a real peak during the summer, and all the willing were coming forward. Now we're in a more difficult stage. But I think it's a harsh reminder that it's not just about the vaccines. I mean, people have also shed masks, distancing, are more lax about that. The gatherings are, they're large gatherings of a lot of people. All the things that viruses love for propagating are now, there for them, there for the virus. So I think that we need to take this in cautious steps, and there will be some freedoms in some ways, but I think we can't do it all in one go without having some situation like now where the virus is coming back.
So how do you get the rest of the population vaccinated?
Well, I think it's hard to ask. Although what I was going to say, people are going to need patience, but it's a hard ask. 18 plus months, almost 2 years into the pandemic, people are feeling pretty impatient, but also it's taken an economic toll on some people. It's certainly affected schooling. So I understand the government wanting to please the people, as it were, with the sense that we're getting closer to normal, or whatever normal was. But I do think this story is not over at all. We can see other places in the world that had it under control a bit more, like in Asia, and now are facing resurgence. Eastern Europe is really having quite a challenging time. So this is, we really still need to be quite cautious. I think some freedoms, some mobility, but you can have more mobility if people comply with masks. At the end of the day, it's all about human behavior.
And, well, Heidi, what about Portugal and the Scandinavian countries? Will they encounter the same problems with their freedom days?
Well, I think for Portugal and Scandinavia and any other country considering opening freedoms, that they're going to need to be careful with how they do it. I think the lesson from the UK is not to do everything, stop restrictions across the board while people are still unvaccinated and while the virus is still raging. So I think if they do it with steps, it will be fine. Let's see what decisions they make at the time.
And besides the decisions governments make, what about us? What about the way or the right way for us to live with the virus? What would that be?
Well, it's a really important point because not all governments are making the best decisions. So at the end of the day, we do have our own judgment. And personally, I would say, given the fact that this virus is still hyper-infective and circulating, and there are quite a few still unvaccinated people, even though we've done quite well overall in Europe and the UK. Lately, it's slowed. We should still I would wear masks. I would particularly encourage it and I think it should be required in public transport. I would avoid crowded places and just protect yourself and protect others. We still need to be cautious if we want real freedom in the truest sense with the virus behind us.
Heidi Larson, London School of Hygiene and Tropical Medicine, thank you very much. Here's a good question now for Derek and for viewers who may have just recovered from COVID-19.
How soon after having COVID-19 can a person get it again?
So you had COVID, maybe you got really sick, and now you hope that your naturally acquired immunity will protect you in the future. And it will, at least to some extent, but not perfectly, and likely not forever. Going on 2 years into the pandemic now, the CDC in the US still says that reinfections are rare. As time goes on, though, a lot of experts believe that'll probably change as the average person's immunity wanes. Exposure has also grown much more widespread in many communities, and the Delta variant is a lot more transmissible than ancestral variants. So, two more factors that increase your chances of getting it again. One recent study published in The Lancet that was based on pretty complex models, it was a little scary. It postulated that if SARS-CoV-2 becomes endemic in people who have already had COVID-19 once, they could, on average, get it again less than 1.5 years later. The good news is that if you've had the disease and recovered, you can lower your risk of reinfection by getting vaccinated anyway. That doing that is a good idea is backed up, for example, by evidence from the state of Kentucky in the US. A study there found that people who'd been infected and didn't get vaccinated afterwards, that they were more than twice as likely to be reinfected as someone who did get vaccinated afterwards. In that situation, early data indicates that messenger RNA vaccines in particular provoke an even more powerful immune response in recipients who've already had the disease. It's a phenomenon that the media is calling a super immunity. And that turbocharged immune response seems to occur even after just a single shot of the vaccine.